Good afternoon, this is Steph from My Surgery app. It is 1st of December. Thanks for joining the webinar. Just going to wait for everybody to attend and join. Okay, let's make a start. Okay, so in today's webinar, we're going to be going through, it's quite topical now, the COVID-19 boosters and how you can link patients off to your health board's booking system if they have one. And the booking system for the first and second vaccination. And then secondly, we'll be going on to how to build an information page to put in the app to let your patients know all about what the health board are doing for COVID boosters this year. So let's share our screen and start showing you what you can do. Okay, we'll make this a full screen for you. Okay, so you can see here we're in our test Surgery Grange Road Surgery, and this is our portal for our test Surgery Grange Road Surgery here. So when you scroll down on the app's practice detail homepage, you'll see that there are dashboard links here, which are book a flu vaccine, book COVID-19 vaccine, booster or medication review. Today we're going to be concentrating on these two here, book a COVID-19 vaccine and book a COVID-19 booster. For this example, and now you can link to three things. You can link to an external URL, i.e. the URL that the booking form that your health board has set up if they have one, or a page, which we'll be coming on to later on, which is basically a patient information page, which we can build for patients. You can link to that, or a form. But the form wouldn't really apply for boosters because you're not requesting patients to fill the forms out. So we're going to link to your URL first of all. And for this example, we're going to use how other health boards go to their website. It's actually quite difficult sometimes for patients, particularly if they're not very good on using computers, to find the information that they require on a website. That's why in an app we make it very easy for patients to access that information. So I've already navigated to this page. It's taken me 1, 2, 3, 4, 5 clicks to get to the page I need to find about how to find the information I need. So if I want to, and you see it's still quite difficult here, but if I want to tell patients that they can book a booster, then there is a link down here. And again, it's quite difficult to find that this is actually a link. But let's click on that link. And it's actually a booking form that the health board have built for patients to request their COVID-19 booster. It gives the eligibility here. So this is, for example, now we wanted to link patients directly off to this. Each health board will have this, or may have it, may not. We'll check it out. But check with your health board if they have this booking form like how they do. We're going to copy that now, and if I go back into the portal, then this is for the COVID-19 booster, and it's already selected URL. So all I need to do now is paste that URL into here and click on save. Now, when I go back into the app at the moment, we've only got the normal buttons here. But if I refresh this now, because I've saved the update, then a new button appears saying link book a COVID-19 booster. And when a patient does click on that, it takes them directly then to your health board's booking page. So patients will not be phoning you so much to request a COVID booster. Again, there's information. Fortunately, this health board has information on how the patient can get a primary dose, i.e. their first or second dose. And again, there's a link there. But when you look at this, it doesn't jump out at you that there is a page there. So patients can click on this link. And again, this is for a first or second dose. Again, we can do exactly the same. Copy this URL and go back into here and scroll down to our portal, and then just click on book a COVID-19 vaccine. And again, it defaults to external URL. And now we can paste into here and click on save. And now if I go back into my app and refresh, a new button appears in the app's homepage called book a COVID-19 vaccine, in addition to the button for book a COVID-19 booster. Each one for the vaccine will go to the different booking forms your health board have set up. So that's very easy. As long as it's got a tick in there, then that means it's available in your app. If I was to take a tick out of the vaccine now and click on save, and again refresh the app, then that button has disappeared Doesn't matter if you've still got the URL in there, but if you want to make it available again, just click on that, save, and that's it. You've automatically set up the booking. I'll refresh this. You've automatically set up nice and easy for patients how they can go about booking their COVID-19 vaccine primary doses or a booster dose, and that's very easy to set up there. Now, what happens if your health board do not have a booking form like how Aadhaar have set up? So we can set up here patient information pages, and we did cover this in the last session, but again, we're going to cover this again now. So this is basically a patient information page to tell patients all about a topic you want to tell them about. So let's now start a new one, and we've got a few examples here, but let's click on a new page, and again, we're going to do this for COVID-19 booster. Okay, so we're going to call it, okay, I need my booster dose. Okay, so this is what we're going to call it. And again, same as in the last video around editing, we need to put a title into here. And as long as you can use Microsoft Word to edit, then this is built on the same premise here. So we're going to make this a title. Let's go for, like I said in the last one, I like heading 2 because it puts a title in here for us. Now, if your health board does not have a booking form, we can simply copy and paste what they have, what information they do have. So here we can see there's information here that we can copy and paste over. So like I said, it took me 1, 2, 3, 4, 5 clicks to find this page, but your patients may not find that very easily. So again, we can just copy and paste this over into the information page, copy and paste, and there you go. All that information is there automatically for patients now. And don't forget, if you want to make it, so this is a telephone number here. So exactly like we went over that in the last training session, if you highlight the telephone number and copy it, and then at the top here, when you go to edit, there's a link button. It'll say link. Then all we need to do is put into here the telephone number, and instead of a URL or HTTP, which means the website, just click the protocol button, and that makes it a telephone number. And there, that allows now the patient to dial that number from within the app. Again, this looks as if it's already set up, but let's check it. Let's copy the email address and again go to link. No, it's not. It's not. So now instead of a URL, just click on email and just type in and just paste in the email address there. So the system will recognize now when a patient clicks on it that is an email address. When the patient clicks on that, it'll automatically populate for the patient an email with that email address, and patients can email the health board directly. This is all built to try and stop patients from phoning you and to inform them what your health board is doing around COVID booking, first, primary, second, or for immunocompromised patients, and also the booster doses. If I was to save that, that's now saved. I can just check it again to make sure that there's no editing issues. I can let's make that a bit better. So again, look at heading 2. Okay, and scroll down a little bit. By the way, if you wanted to make this easier to edit, then these arrows make this a large page. There we are. This all looks good to me, but I would like to make the contact a bit bigger. So I'll put those in bold there, just to draw the patient's eye. There we are. I'm happy with this. So I'm now going to make this page active. You can select to put this but because you can put it in a position if you want to do it on your dashboard page. But because we can link now any button to an information page, then I suggest you just make the page active. Okay, so this is we do need a booster vaccine. So again, let's go to the patient's to your practice dashboard. Now, if your surgery does not have a booking form, instead of linking to an external URL to your health board, then we can link to a page, an information page, and the page we just built was called I need my booster 19 booster, and save that. So when I go back into the app now, whereas previously patients were diverted to the health board booking system, if your health board doesn't have one, you've built an information page, and when a patient clicks on this, it takes them to the information page you've built for them to tell them exactly how your health board are running the COVID-19 boosters or the COVID-19 primary and secondary doses. So that's how you build a page and you can link anything to these information pages. And if you wanted to edit any information pages at any given time, just go back into patient information pages, and there it is. I need my COVID booster. You can click on edit and edit those details anytime. Again, like we showed in the last session, you could put educational videos in there, you could put images in there if you wanted to, but don't forget that if you, whatever you put in there, to make it easier for patients to access these services, just enable the call now or email now buttons, and that will enable patients to phone these services directly through the app. Okay, so we've had feedback from you guys over the last from the last two webinars to say they're a little bit long. They went on for 30 minutes. We covered a little bit too much. So that's all we're going to cover in today's session. Please do go into your portal, update your details. So when you go to the portal, the first page you come to is your practice details. This will populate for you, and then take a look on your Health Board's website to see if they do have a book. Just type in your Health Board's website here, and in the drop down they should have a button for COVID-19 information. Like I said, sometimes it's very difficult for patients to find the information they're looking for. It does take a few clicks, but if you know what you're looking for, so you can click on that and supply then the links in the URLs under book a COVID-19 vaccine or book a COVID-19 booster. And as long as it's ticked, that will then become available for patients to see in the app. Okay, that's it for today. Just a reminder, in your portal, there is a button here for marketing materials. We do suggest, we have put these in order now of what works best. So the first one that comes up is always a text message template. So there are lots of templates there that you can use, many templates to tell patients how to sign up to the app. And again, just a reminder, whenever you are sending anything out to patients, then please do include the Apple and the Android URL. It's pointless putting anything out for the patient to tell patients that you have an app without giving the patient a link to click on. As long as you include these links, then the patient can click on it and go to the Play Store to download the app directly. And the links are always included in anything we put out for you. The marketing pack, we have added also prescription stickers. So there are little prescription stickers you can order with a QR code on this. You can put onto prescriptions, and it does. All the patient has to do is scan that QR code. They can download the app straight away by scanning that QR code. If you'd like to order these, as I said, we don't make a profit on print at all. We will just process the order for you from our preferred supplier. We do get massive print discounts because of how much we print, so please do let us know. Again, the social media assets and posters, you can download these, but again, make sure you include the Apple and Android URLs on anything you put out there, just to ensure that patients can click on the link and download those apps very easily. Again, the web material is here, and we are producing a video for you to tell you exactly a walkthrough of how you can increase your app downloads. That will be available hopefully in the new year, in January, just finishing editing now. So that will be coming out quite soon for you. And again, the videos for staff and for patients you can download, and the QR code you can download and print that anywhere. So there's lots of information there for you on how to tell your patients all about the app. And don't forget, just below here, we do have a closed Facebook community user group. I think it's got about 150 practice managers in there and GPs at the moment. And this is an area for you. If you just click on join our group, you'll answer a few questions, just your email address and which practice you belong to and cluster, then you have full access to the group. And in that group, we do tell you all about our new initiatives, new updates of what's going on in the app. You can ask for stuff. You can interact with that. There we are. We've got 138 members. They're all practice managers and GPs who we currently use in the app. Do join this group. It's a really good resource, and we tell you all about stuff that's going on in the app and some hints and tips for you there. So that's it for today. As always, if you want, this will be sent out as a recorded file for you by email today, along with all the other webinars as well. So if you have any questions, please do put them in the chat now, and I'm more than happy to help. Any questions? No questions. Okay, then that's it. Thank you for today. That's the end of today's webinar. We'll see you next Wednesday in the next session. Thank you.